Hello, my name is Laura Whitehead and I'm a critical care nurse, a lecturer at Middlesex University, and very recently I've become a podcaster. So I present Navigating Nursing, which is a podcast that I started in October. And I really started it because I felt like 2020 was a year where there were a lot of changes in nursing and there were a lot of pressures and lots of people's roles changed dramatically over the course of the last year due to COVID. A lot of nurses were redeployed, they had to work in areas that they perhaps hadn't even considered working clinically prior to the pandemic. And I think it's led to a lot of nurses thinking about their careers, what they would want out of it, and potentially considering a change in their career path completely. So the aim of this podcast really was to highlight how diverse nursing is as a profession, and also to highlight the different career opportunities that are available to registered nurses working in the UK. So the main thing I wanted to start off with, there are hundreds of posts available. I think a lot of the time we have a look at NHS jobs and we put our search criteria in, and there might not be any jobs that we feel like doing or jobs that we think that we are capable of doing or applying to. So first of all, relax. If you're looking for a new career, it's all about the research and having a look into what's available. Try not to limit yourself too much and really broaden your horizons. Another thing I would say is don't discount the experience you have. A lot of jobs will have essential and desirable requirements. So when you're looking at that post, see, do you meet those requirements? You might not have the essential, what's on the list that they've advertised, but by getting in contact with the matron, the charge nurse, recruitment, whoever has advertised that job, they might actually say, yes, it was on the essential list, but they would still accept you. For example, without a full master's, they would accept you with a master's module, as you can prove you can work at level 7. So personally, flexibility within what is an essential and what is a desirable requirement. So please don't discount yourself before you've even put that application in or before you've spoken to the recruiter for that particular role. Another really key point would be don't discount the experience you have outside of nursing. I think a lot of the time on our CVs, our personal statements, our job application forms, we really focus on where we've worked clinically, the patient-facing roles that we've done, the admin roles, the management, things that have happened within the clinical area. I actually got my lecturing job based on teaching experience that I'd had through youth organisations and volunteering that I'd done. I'd been heavily involved with Army cadets, I'd written programmes, I'd marked, I'd written specifications, but actually I hadn't formally been employed as a nurse educator. However, outlining what the experience that I'd had led to quite an interesting conversation during my interview, and ultimately led to me getting the role. Make sure whether that's a sport, whether that's a hobby, whether it's that you're involved with a religious organisation or a charity, please make sure that you make the employer aware actually that's your unique selling point. That's something that makes you stand out from everyone else that has applied for that role, and that's really important. I've put think outside the box. So a lot of the time, as I said earlier, we just look at NHS jobs, and it's really important to kind of widen the search engines that you're using. So having a look at things like Indeed.com, The Guardian Jobs has a lot of information, jobs.ac.uk, they advertise a lot of meal within ACC institutions, and charities. It doesn't have to be, if you want to stay in the NHS, of course, NHS jobs or looking at the trust's individual job adverts, job opportunities pages is really important. But if you wanted to look outside of working in the NHS or the private sector, looking at these other search engines is a really good way of finding out different opportunities that are available. I think as well you would be very surprised at the job opportunities that are available for nurses outside of patient care or patient-facing roles. So really by having a look and seeing what roles will accept, or that want to employ nurses because of your degree, of your clinical experience, I think you'd be really surprised to see what is available out there. I think from the podcast that I've really learned and has been a very common theme has been the educational opportunities that the nurses that I've interviewed and that I've spoken with. A lot of them have a very range of opportunities. They actually, all of them, most of their qualifications aren't in nursing. They've done further degrees on medical law, on law in general, on sociology, anthropology, policy, history. So if an area of interest, if something interests you, or you've done a previous degree or a previous master's or a previous diploma in a topic that isn't specifically nursing or healthcare related, you've still learned key skills. Even if it's critical analysis, writing at level 6 and level 7, you've learned key skills from those academic qualifications that can assist you and that are transferable into nursing. If you do wish to further yourself from an educational opportunity, from an educational point of view, it's really key that you sit down and you speak with your practice educator or your clinical practice facilitator within your trust. It might be that your unit employs a specific PDN or CPF, depending on the job title, or it is that you have a general trust one for postgraduate education. Make an appointment, have a meeting, go and speak to them and ask what is available. What are the courses that they recommend for someone in your position to apply for? What are the academic institutions that they are linked with? What funding is available? I was very surprised at the amount of support that I've managed to get through my career in terms of academic courses being funded for them. And I think a lot of the time we can be put off, or the trust hasn't got a lot of funding, we don't know how much funding is available, where actually just by asking, go and have the conversation. It might be that they say, no, this year we don't have any. If someone drops out of a course, we can put you on the reserve list, for example. That's what happened to me at one of my trusts and ultimately led to me doing a further module. If you're going to self-fund, that's something that is obviously your prerogative and your responsibility. Again, making sure that you have the support from your workplace. If you need to have, say, a particular day off every week, it's really important that they're aware that you're doing this course, and they might be able to be more flexible and supportive with your time that you need off to attend those study days. Now, because of COVID, everything in academic institutions, a lot of things in academic institutions have moved online. And I think it's shown us all what the flexibility we can have with distance learning and online modules. I personally, back when we had to have a mentorship qualification, I did mine and I self-funded through the Open University. One of the nurses that I've interviewed, Sue Everett, she actually did her degree in counselling courses through the Open University, and she found it's a challenge. It's a different way of learning, but it is a way that offers you more opportunity, more flexibility, and the cost is something that is quite different. You can also apply for funding through a charity that might be linked with your trust. So my previous clinical work was at Barts Health. There is the Barts Nurses Charity that you can apply for funding through. The Royal College of Nursing also supplies. There's fellowships and grants you can apply for. So make sure you have a Google around what's available for nurses and see whether can you put an application in for some funding. Another thing that's been mentioned is to branch out and potentially to branch out of your comfort zone. I think sometimes in nursing, there historically have been very preset requirements, you have to be qualified this long before you can become a band 6. You have to have worked in this place for this long before you can apply to work in intensive care. I think now moving forward, a lot of clinical areas have changed their requirements. There's a lot more flexibility. There's a lot of job posts that are out there and that are available and that are vacant. So don't be scared. My thing is be confident, apply, have a conversation. The worst comes to the worst, you have an opportunity to get back about your interviewing skills, and that isn't a bad thing. So I'm now just going to cover some kind of areas of debate that have come up through the podcast. Some of these are aimed at newly qualified, student nurses and registered members of staff. The one big thing that has come up time and time again, and that really comes up with my students asking me in lesson as well, is I'm afraid to specialise too early. Don't specialise too early. I think previously a lot of areas would only accept you to work on a cardiac unit or a respiratory, for example, or a neuro intensive care when you'd had a set amount of experience. Now that has completely changed. Each unit has their own requirements. So please don't be too worried about choosing quite a highly acute or specialised area too soon. I've spoken to nurses also that have worked in the community from being qualified, and they're really with their decision. We found they were very well supported. Same as nurses moving into intensive care or the emergency department, wanting to be in that from newly qualified. I've interviewed a few nurses that have done that, Tim and Gareth, both from being newly qualified and having had some experience, and they both found actually going to those clinical areas as a newly qualified member of staff, as long as the unit that you're going to, as long as there is that preceptorship program in place and you do have a buddy or a mentorship system with a more senior member of staff to you to be supportive, you can work those areas newly qualified. I would say make sure that you find the area that is supportive. That is the most important thing about becoming newly qualified. There are a lot of stresses and challenges that you will face, particularly if you're qualifying this year and we're looking at kind of the post lockdown, what restrictions we'll have in place. You know, a lot of roles and a lot of areas have been shut or reduced services due to COVID, and we still don't know how those areas are going to run going forward. So I would say make sure that you have the support, make sure that you have a clear kind of designated buddy or someone to go to for that support. Ask about the preceptorship program in that trust. What study days are included? Do they have the day to do catheterization? When will you do your IV study days, blood products, IV, your cannulation and venipuncture, and catheterization as examples. So ask about what kind of fixed study days are in place that are offered as standard for newly qualified members of staff, and also what is the supernumerary time and what would they do should that time need to be extended. So do just make sure that you seek out that support. Another thing that student nurses or nurses are quite kind of as a misnomer around working in outpatients. I think previously people might have unfairly had opinions around working in outpatients in the community as though they were less acute areas, as though by working in those areas you were going to de-skill yourself. Nurses working there are caring for very complex patients, delivering very specific, highly trained care. So please don't be put off by working in these areas. It's all about finding a career that fits in with your lifestyle, with your life, with what you're interested in. So don't let those kind of preconceptions off. Practice has changed dramatically over the last 5, 10, even the last few years. And a lot of acute services are moving into the community. I remember one of my friend works in community and they're putting NG feeds in, giving TPN, bloods, cannulation, tracheostomy care, dressings. It's not just the inpatient secondary care environments that are giving this acute care to patients. And that's something that's really important to remember. Another area of debate is looking at doing master's study. A lot of students that I speak to, or a few students, are looking at wanting to do a master's straight and newly qualified. That's something that you would need to think very carefully about. And I think before you start any academic qualification, I think you need to think about why are you doing that qualification? What are you trying to achieve by having completed that? Is it you're particularly interested in that area? Is it that when I did my critical care course, I was working in intensive care, I knew I wanted to look after the sicker, more unwell, stable patients. I knew I wanted to learn about the ventilators, the hemofiltration systems in more depth. I knew that I wanted to work towards my band 6. And in order to do all of those things, I needed to have that theory, that level 6, level 7 university academic qualification to support that role that I wanted to go and do. So have a think about why you want to do the qualification. Have a think at the impact that it would have, and also again look at your clinical experience and what you choose to aim. Now you can get a student loan to cover master's courses. I've had friends that have done full-time and part-time nurses while working as nurses. They've either reduced their hours in their contract and then have added on bank shifts, or they've left their role, completed the master's whilst doing bank shifts at the same time to supplement their income. I've had a lot of students this year that are really keen to take a break before they start working. And I think that is one of the stresses as well with COVID. We feel like we haven't had a break, have we? We haven't had holidays in the same way. We haven't seen our friends or our family. And I think a lot of students at the moment are feeling quite daunted by the fact that potentially in September, they could then be working full-time as a registered nurse. The one thing I would say for this is look and see what the jobs are. Look and see if there's a that you really go and speak to that ward manager, go speak to that matron, that sister, that charge nurse, and say, I really want to work in your clinical area, but I would only like to start, say, in November. We know that your pre-employment checks take a long time, your DBS clearance, your occupational health, you're getting your contract through. That takes a very long, for some of jobs I've done, that's taken 6 months. So if you can get that process started and then have your fixed kind of start date for later on in the year, but do make sure you communicate that with at interview or pre-interview with that ward manager or whoever is recruiting that job. Kind of to fit on with educational opportunities, there's also a lot of certain areas and certain nurses have opinions about you shouldn't be promoted too early. I've had a student a few years ago that said, I want to be a band 6 after 6 months. The one thing I would say is look at the role that you want to do that would mean you are a band 6. A lot of them want you to be signed off for your preceptorship, for example, so at least to have that year or that 6 months under your belt, so to speak. But making sure that you're clinically competent. You've got to make sure that you're safe and that you're comfortable working in that environment before you're taking on those additional responsibilities. Certain areas will be very kind of particular about what they want their band 6s or band 7s, or what skills that they have. And also the level of responsibility changes on the size of your unit. Some areas might want you to be working as a ward manager as a band 6, other people that's a band 7. My unit, my last clinical area, was a very large unit that employed hundreds of nurses. There were 7 to 10 band 7s at any one time. So as a band 6, you weren't involved in things like rota writing, annual leave, but you did do appraisals, you mentored members of staff, you did sign off people for the critical care courses and other academic courses. So find out what that role entails, but make sure that you've got that grounding first. I'd recorded with someone last week who said, don't run before you can walk and don't walk before you can crawl. And I think that's quite a good analogy to see what steps you have to take in your career. I know a lot of the time we're in a rush. I'm in a rush. I'm a very impatient person, but I think it's all about making sure that you're safe and making sure that you're confident in able to do that. I think taking things on too soon can lead to lack of confidence and a lot of unnecessary stress. By waiting another 6 months, by waiting another year, doing some further study is a really, it didn't harm anyone. So just be kind to yourself and don't try and put too many potentially unrealistic career goals onto yourself. So ultimately, find a role that makes you happy. That is the most important thing. And I think it's something that as nurses, we've really realised in this last year, we need to make sure that we're happy. And is that by finding a job that is Monday to Friday, 9 to 5? Is that finding a job where you work weekends? So that gives you the flexibility in the week. Is that you want to go back to university and do further study? Sit down and have a think. If you're unhappy in your role, if you want to move, what do you think would make you happy? What if you could write down your ideal job, what would that be? For me, that was lecturing. I wanted to teach students. I wanted to do further study. I wanted to take part in research. I wanted to help design modules and content and teach postgraduates. And I'm very fortunate that this role allows me to do that. As a lecturer, I have Christmas off, I have weekends off, I have my birthday off if I want to. So really look and see what within your lifestyle, what fits with your life and your lifestyle and your commitments outside of work. A really key thing that when you're looking at applying for jobs is speak to the matron, the ward manager, whoever is advertising the job. On all jobs, there will be a please get in contact with, and there will be an email address and a phone number. It might be at the moment that the phone number isn't cool. Now we're working from home, there's been a lot of changes with that. So an email. Ask, can you arrange a meeting to have a conversation? Ask them about what are the educational opportunities, what is the supernumerary period, how often have the nurses that worked there? If everyone's been there for only 6 months, it can give you an indicator about that workplace potentially. So do just have that conversation. At the moment, it will have to be virtually due to the situation, but Zoom is as good as being in person or Microsoft Teams or something. So do arrange that meeting, the week before that closing date to give yourself that opportunity to ask those questions. They will also give you some advice and maybe a bit of an outline about the interview. So do ask them. If there is a requirement that is an essential requirement, for example, a master's quality you don't have, that's a good time to have that conversation. Do they want you to have the whole master's, or are they happy for you to have the individual module that is related to that role? So if it's a nurse practitioner job, are they happy for you to have the advanced nurse non-medical prescribing and also the advanced assessment module? They might be happy for those two modules rather than the whole advanced nurse practitioner module, advanced practice module to be completed. Always ask for feedback. I think sometimes you walk out of an interview and you think that was horrendous, they will never employ me, it didn't go very well. And then you actually speak to them and they said you interviewed amazingly. They can give you those key points. Very minor detail. Even if you're not successful with the interview, ask them. I had a role that I interviewed for. I thought the interview went really well. I found out later that I didn't get the post. I rang and spoke to the lead interviewer and they said that I was second in line to get the job, only because the other candidate had an extra 3 years clinical experience than me and had set up a simulation centre himself, and that was why they gave him the role. So that helped my confidence not think that I'd done something wrong, and it just kind of gives you that confidence and that boost for other roles in the future. And my last point, remember that nursing is one of the broadest out there. I put nursing in brackets because you can be a nurse and be in a variety of roles. We see in the media, particularly, nursing is standing in front of a patient and providing that patient care, but you can work in occupational health, a travel clinic, an outpatients, a sexual health clinic. You can work for a company and guess around COVID secure setup. I'm a vaccinator trainer. I've become one since December, and I'm part of the team with Middlesex University and UCH training members of staff currently. We're working out of the Business Design Centre in Angel. Pre this year, I would never have thought I would be training up people to be vaccinators, but here I am. So really think about what are available. And last but not least, is just my podcast, Navigating Nursing. So it's available on iTunes, Spotify, and also via the web link available here for free. My podcast, as I said, aims to inspire nurses. The first series is based on nurses in advanced practice or clinical nurse specialist roles, and that's all available now. My current series is the leadership series, and I'm interviewing nurses that are in a wide range of leadership posts in charities, universities, trade unions, and within the NHS. Please have a listen on iTunes. If you could leave a review, that would be amazing. And please get in contact. But good luck, and I look forward to hearing your questions.
Welcome, Laura. How are you today, and where are you joining us from?
I'm in Woolwich in London. Thank you so much for having me.
Oh, no, thank you. I was going to say, it's great to have you with us, and thanks so much for the presentation. Some great stuff in there. The be good to yourself, be kind to yourself, message jumped out for me as a particularly good one when it comes to career pressure and everything else. So thank you for that. We've got about 10 minutes now for questions. So audience, this is your opportunity to find out more from Laura. So please send them in using Swapcard. I think we've already had one in actually. But in the meantime, I've got a few questions of my own as well. So I'll start off by, so as I said, we had a question in from Amanda Jones, so we'll get hers in first. And she asked, what opportunities are there to work in the acute sector with a public health MSc? She's currently completing an MSc in public health, she says. So quite a specific question.
So I would say really think of within your public health MSc, why did you apply in the first place? Was there a particular module or dissertation project or research project that has really interested in you? Obviously, public health is a very broad sector, and I think there'd be a lot of jobs that would be really interested to have someone that's a nurse and a public health has done that further qualification. So I would really think back to you and why you've done that course and what's really interested you and there's been a particular area of focus, and use that almost as your starting point before you then go to look at different jobs and roles that are available. Because really with a qualification as broad and as interesting as that, there will be so many jobs that will be really pleased, particularly now. I think particularly the world that we're living in at the moment, they'll really need someone with that level of expertise that you have.
Great, thank you very much for that question and answering as well, Laura. So moving back to some of the things I had, just while more people get their questions in. What was your actual original motivation for starting the podcast?
Really, it was my background's critical care, and hearing a lot of my friends working in intensive care at the moment after the last year with COVID were really looking at what other jobs they wanted to do, what they actually wanted to be going forward. They knew they wanted to step away from kind of level 3 critical care environment. They just didn't know what, and I just thought it's almost like the greatest secret of nursing, and we don't no one. It's never really kind of clearly available of how do you become a when I wanted to go into education, it was like, but what jobs are there? How could I apply? Where do I look? And it's just kind of endless Googling and kind of searching. You come up with some answers, unless you're lucky enough to know someone that you trained with or that you've worked with that's gone into that role. It can be really hard to kind of get that almost insider information. So I really wanted just to
Yeah.
lift the lid on the careers that are available and make it more accessible. I think particularly now studying at level 7, master's qualifications is becoming a lot more popular. There's a lot of new roles that have really, from a nurse practitioner, from advanced critical care practitioner point of view, that have really opened up in the last, 5 years. I think before people apply to those modules, it's good, and those courses, it's good to have not necessarily an end goal, but just an idea of what they could do with that. And particularly the series at the moment about leadership, from a similar vein, how do you become a leader? When you look at the chief nurse for your trust, or the president of the RCN, or the chair of the British Association of Critical Care Nurses, how do you become that person? And I think it's just really interesting to hear all the different ways in which they've got to the current position that we're in. So yeah, just demystifying everything, really.
Yeah, absolutely. That's brilliant. Yeah, I mean, as you say, the that sort of insider knowledge is well, yeah. How do we get that out there? Yeah, it's like you said, the leadership stuff is very interesting. The around the networking and everything else, and also just becoming a nurse manager. I would have thought is as you say, we hear so much about you get promoted, but then you're sort of on your own. But anyway, so yeah, you said you're doing leadership. So have you got plans for another series after that? And if so, what will that be about?
I do. I've got about 3 series planned in my head. It's just the time. I really want to do one looking at nursing associates, particularly looking at people that qualified kind of in the first pilot. So if you are one of them, please get in contact on Instagram or Twitter to really kind of, again, lift the lid on the different roles that you can do within that. It's still considered a fairly new role, and Middlesex University, we were one of the really lucky ones to be one of the pilots for the nursing associate programme that started a few years ago now. So I want to focus as well on child. I want to do a mental health field. I'd love to do kind of, sorry, I'm like telling you my life plan. I also really want to focus as well on kind of courses that are available, and I really want to kind of go around the UK and interview different module leaders for different postgrad courses, and almost make like a mini kind of course booklet, but do it as a podcast. So yes, I've got a lot of ideas.
Sounds fantastic. Yeah, brilliant, absolutely brilliant. Yeah, so hope it all comes to fruition. Yeah, they need to give you more time. That's what I'm going to say. Anyway.
Yeah, just some time, just a little bit.
Well, yeah, we could all do with a bit more time, couldn't we? But yeah. So, I mean, obviously, the podcast is there for basically to help other people learn or get ideas. But have you learned anything yourself from doing the podcast?
I have, and I think it's quite easy when you're working clinically to have an idea of where your career is going to go. I'm going to be a band 5, I'm going to be a band 6. I like the idea of that band 7 job. You can kind of have quite a clear what courses you're going to do. And I think moving into academia, I then wasn't really aware what I wanted to do going forward. I know I love what I do, but what's my target and what's my aim? And to really speak to, particularly recording the sessions with our advanced nurse practitioners, and then again the leadership, to see there's parts of their career and courses and opportunities they've done that I think, oh, I'd like to do that. So that's been quite a good enlightening, for me anyway.
Oh, great. Just from sort of the practical side of things, I mean, is the technology easy to do? I mean, could anybody do a podcast without any particular know-how?
I can barely work an iPhone, so if I've managed to do it, it's literally possible for anybody in the whole world to. Yeah, I just watched a couple of YouTube videos. I use Audacity to actually to record, and I use Zoom, and I just get the audio from Zoom and then edit that in Audacity. I was really slow. I think my first episode took me 4.5 hours to edit on a Saturday, where now I'm at least half that. So I'm sure there are 12-year-olds that make these all the time that do it in about half an hour. But I am getting there. But no, and I think it's really shown me, if you want to do something, just go and do it. If you've got the drive, being on here is, I never ever thought I would be speaking at a Nursing Times career event ever in my career. So the podcast has really shown me that anything is possible. And if you want to do it, just go and do it. If it doesn't work out, then at least you've tried.
Great advice there. We had another question in from Shifani Passap, and they are a second-year student studying adult nursing. However, in their first year of clinical practice, their placement got cancelled due to COVID. They're interested in becoming a theatre nurse or going into recovery and anaesthetic nursing. Will be qualifying as a Band 5, but what path would I go down to achieve this? So I was reading that off the screen.
No. So theatre nursing and scrub nursing is really popular. I know at the moment they've limited the amount of students they can take there in clinical placements. So probably for this academic year, you might not have the opportunity to work there. Some universities let their students request placements. So it could be that you could get in contact with your program leader or the clinical placements team to ask, could you actually specifically go there? If not, you might be able to book a bank shift just to kind of get a feeling to see, do you like working there? If you don't want to kind of book bank shifts and work there as a HCA, or they might not have the opportunity available, I would get in contact with the ward manager, the area manager, and ask, can you come and maybe do a shadow day? Can you get advice from them? They might have a particular rotation or preceptorship program that's available for newly qualifieds. But it's all about looking at the trust and where you want to work, and then getting in contact and asking.
Great, sound advice. So we're basically out of time now. It's whizzed past, but thank you very much, Laura. So we've now got a content break, and we'll be back at 11:20 for our next session, which is with Annette Bodden-Whisker, who's a former lead theatre nurse and Army Reserve nurse. She had a very varied and fascinating career. In the meantime, make sure you get connecting with employers and arrange the video meetings to find out their secret codes for the prize draw later. So thank you very much, and thank you, Laura.
Thank you.